given that the clinics exist, at least in a few areas, or that they may be coming to a neighborhood near you or your practice, and that your patients might choose to use them, what can we do, what can you do to sort of prepare for this and to work with them? What should you be doing to think about this? So I'm going to suggest a couple of things. The first is, I guess I'd call it self-evaluation or a reflection of the current practice. And the second are some very simple direct communication techniques that you can use. And then I'm quite certain you'll have many suggestions yourselves as to how you might use, what else you might be able to do. So both of the other presenters have mentioned access. And I think that's the first thing to consider is what is the access in your practice? Can I get in for a quick visit, as they'll call that 7-minute visit versus the 42-minute visit? Can I call and get a response, or do I understand which button to push to get an eventual response? What is it like trying to get into and booked into your practice to see you? So think about assessing your own practice and what's going on. Is there something you think you could change or that you should change? The second thing I would suggest we could mull over is the kind of communication that we do with patients. Do you know how satisfied your patients are with their communication with you, with your office? Despite the time pressure that everyone feels in a visit, do they think they can ask you questions? Do they know who to call with questions? Can they get the questions answered? Are there other resources that they have or that you can give them for information and for clarification? So I know that sometimes people will say that they've dialed their own office to see what it sounds like on the other end of the phone, or will phone at lunchtime to see what it's like to deal with the answering service. So these are sort of a way of doing some self-assessment. The other piece that I was thinking about is that a visit to a minute clinic is in one way or another, whether the patient is yours already or might become yours because they don't have a primary care. It's another handoff. It's another transition of care. And at every point of transition, we open the door for misunderstanding. So what I was thinking about really is, why not open that conversation with your patients? If there's a clinic in your area, or if they're traveling and go to a clinic, and help your patients understand what they should ask in the clinic and what information they should be sure to bring back to you. What information do you want back from them? And the Ask Me 3 is 3 questions that patients can ask. What's my main problem? So you get a diagnosis, but I know it is a problem rather than a diagnosis. What should I do about it? So you have a treatment plan. And why is it important? And if we do something as simple and clear as that, we may have a better exchange of information. I think patients who you already have in your practice, should they choose to go to the clinic, might be better able to assess the quality of care that they're receiving in the minute clinic and to bring you back the information that they think is important. So when we were discussing, the panel was discussing what we might do or what we might say, something as simple, if you have if a clinic opens in your area and you find that some of your patients are going, maybe your office could create a tip sheet on how to use when is it appropriate to use the clinic? When would you really rather they come to see you? How can they do that? And what kind of exchange of information should there be?